Shalom in your hearts and homes, and welcome back to a Culty Talk. I'm Rachel-Selah, and I'm happy to be here. I'm driving. I didn't get to make a video last week because I just was super busy preparing for homeschooling for children through distance learning. So I was just trying to get my house in order. And that didn't leave a lot of time for anything other than getting my house in order. So I apologize if anyone was expecting another video, but you probably weren't because my channel isn't that popular yet. Notice I said yet. Anyways, I'm happy to be back, happy to be alive. All praises to the Most High. So in my last video, I talked about making, and I'm sorry if I'm not loud enough, I'll talk louder just in case. But I talked about postpartum. My video is going to be on postpartum tips. So this is also going to be a two-part because the postpartum period you can talk about the postpartum period that's right after the baby's born, and then the postpartum period prolonged, which most birth professionals like to refer to as the fourth trimester. So today we're just going to be talking about right after the baby's born, postpartum right after the baby's born, not the actual fourth trimester. So where to begin? You've had your beautiful bundle of joy. You pass the ring of fire and you've had the final push. So we'll talk about delivering the placenta, because it's something I feel that is something that moms don't know about until they're actually giving birth. And it's not really something that's talked about, and how important it is to, one, ask your provider to let you delay the clamping of the cord. Delaying the clamping of the cord is super beneficial for your baby. You don't have to have a lotus birth. You don't have to, let your baby's placenta fall out. I'm someone who kind of finds that type of thing kind of gross. So, and that's my personal opinion, and I'm allowed to have that. I find the lotus birth thing kind of gross. I don't want my baby I don't want to be sitting around with a placenta attached to my baby for however long it takes to naturally fall off of the baby. I'm cool with a cut, but I do allow for cord clamping to be delayed. So my standard time for all of my births outside of my cesarean births have been because I wasn't allowed to cord clamp during my cesarean births. That was with my twins and with my firstborn. I cord clamped with the two youngest, and with my second baby, which were my home births. And I let about 45 minutes go before we, cut the clamp and clamp the cord and cut it. And that was to let the last blood that goes between us go back to the baby. Let the baby get all those good stem cells, all those good cells that they need to make it outside of your womb. Not to say that they can't, but it's way more beneficial for their immune system, just for their body developmentally. And okay, so now you've clamped the cord. You waited your 45 minutes. You clamped the cord because truthfully, that's about how long it takes for your placenta to come out after you've already delivered your baby anyways. Now the placenta coming out, it's not painful at all. I mean, it wasn't for me, and I don't think it really should be, because it's just like a blob of organ coming out of your lady parts. So for now, I'm just going to tell you, I'm going to refer to your vagina. I don't like that name because that's a name that a man gave to our reproductive parts. All of our reproductive parts were named by some Italian guy who had terrible medical practices, unethical medical practices, and did experiments on the bodies of black women slaves and was able to sit there and cut women open and name their body parts. So I'm not naming my lady parts after a sick Italian man who didn't have no place in women's business, but we ain't even gonna go there. So I call my vagina, for lack of a better term, since y'all don't know, I call her my good girl. So from now on, when I'm talking about my vagina, I will be referring to my vagina as my good girl. So now you know, when I say my good girl, that's what you know. That's how you know what I'm talking about. I'm sure everyone has a name for their good girl, but I call mine a good girl. Anyways, so when your placenta comes out of your good girl, it shouldn't hurt. I mean, it doesn't hurt. I can't say it shouldn't hurt because I can't speak for every mom. It's paramount that your placenta comes out intact, because then that means that there may be some left, which will cause hemorrhaging, but you don't have to worry about that. My main point was to talk about the clamping of the cord to give your baby that little extra time. So now your placenta's been delivered. Let's talk about being at the hospital and having been given the privilege, because it's a privilege at the hospital to clamp your cord, for delayed clamping, excuse me. So you're at the hospital. Hopefully your partner's with you or your doula, and you can send them if you haven't been having skin-to-skin contact, because that's important too. So let's go back over it. Delayed clamping, that means letting the blood pump through the cord from the placenta to your baby. And during that time of delayed clamping, you can bond with your baby. Skin-to-skin contact, so important. Skin-to-skin contact regulates the body temperature of the baby, gives you hella oxytocin, which helps your uterus contract, so that it can shrink back down, start to begin the process of shrinking back down to its normal size. All these it makes you love your baby. So it helps your brain to recover from the trauma of, almost giving your life to bring a child into the world. So skin-to-skin contact, delayed clamping. So now you and baby are resting and loving each other. They want you to now get up and see if after I forgot one thing. So we're speaking of the uterus contracting back down to normal size. If you have whoever your provider is, they may want to palpate your uterus. That means just you doing a massage to make sure that it's in the right position in your body, that it's going back down into the right positioning in your body. So look out for that, because I will not lie to you. Right after giving birth to a baby, a uterine massage is extremely painful. But deep breaths as you would through your contractions, and it's bearable, and it's super necessary, because you have to make sure that your body is you're healing properly from the birth already. It's an immediate process of let the healing begin, let the snapback begin, so to speak. Not snapback as in your outward appearance, but snapback is as in your uterus is an amazing organ in your body, and it has its normal size is maybe the size of your fist, if that, and it stretches to the size of a watermelon. So it has to go back down, just for your sake and for the health of your body. So we got the uterine massage, we got the cord clamping, and we got the skin-to-skin contact. And mind you, again, this is just postpartum. Literally, we're talking minutes to hours after you have given birth. So I'm gonna make this video pretty short. I don't want to go over 15 minutes here. So you've done you're now relaxing. You should be relaxing now, whether you're at home or whether you are in the hospital. Now let's talk postpartum care at home. By now, you would be laying in your bed, relaxing, getting energized. I encourage you, here's some postpartum tips. Using the bathroom. Let's talk about using the bathroom, right? Because they want you to pee to make sure that your bladder is okay after. That's one of the main things. They want to make sure your bladder is okay. So they expect you to, to pee so that they can make sure everything's all right with your bladder. So when you pee, I'm going to keep it 100. It burns. Oh my God, it burns so much, especially if you've had a vaginal birth. So expect it to burn. Do not be shocked if it burns, because there's like little superficial tears that happens when your good girl stretches. I'm going to give you some tips on perineal massage to keep the stretching from hurting, like the tears, from there being too many tears. Perineal massage is super important, super helpful. On the next, I'll do a short video on perineal massage. Probably next week or sometime this week. I'll try to post that. But, crap. I'm sorry. I got a little distracted talking about perineal massage. Hilarious. So, oh yeah. Okay, so it may ache. Your vagina, your good girl just might be aching and burning. So I have a recipe for ice packs for your lady parts. And they're actually healing ice packs. I'm going to do a tutorial for those ice packs and post them on my page. But those ice packs are super great for after your first trip to the bathroom to clean yourself up and get, comfy in your jammies. This is for home birth. Get comfy in your jammies and hunker down for your recovery. So you want to not wipe yourself, but hopefully your midwife has provided you with a home birth kit, and you want to have your peri bottle. Peri bottle is a bottle that you can squeeze water onto your good girl instead of having to wipe. So the peri bottle, it's like a bidet almost. I don't know if anyone knows. If you don't know what a bidet is, I encourage you to Google it. It's like a mini bath for your booty and your good girl. But I'm starting to run out of time because I really did schedule a 15-minute block to make this video. So I just want to reiterate and recap what we discussed in this video so far, which is postpartum care. We talked about cord clamping. We talked about skin-to-skin contact. We talked about uterine massage. And we talked about caring for your good girl right immediately postpartum with bathroom use and just overall comfort for coping with the uncomfortabilities of a postpartum experience. In my next video, this may actually end up being a 3-part, and I'm sorry if you have to watch a whole bunch of videos, but I just want to make sure I cover all of the bases, because postpartum care, having a good plan and a good experience in your postpartum period definitely helps you to be the best mom that you can be. So I just want to make sure that I'm helping my mamas out there get that done. So in my next video, I will talk about perineal massage and also give a quick demo of how to make the good girl ice packs. I pray that everyone has a wonderful week, and I love you all, and I thank you for watching my channel. Please subscribe and hit like. Shalom in your heart and shalom in your home.